Port Moresby General Hospital, the country's biggest referral hospital, announced the big city is experiencing a fourth wave of COVID-19. Dr. Kone Sobi, Director of Medical Services at the hospital, said today marks 8 days of the surge.
Daily we've been tracking, and our tracking rates daily have since the 1st of December has been sitting around 5 to 10%. On January 21st, we noticed a sharp rise in the testing rates from 5-10% to 28%. As of yesterday or the last 24 hours, our testing positive rates are about 80%. So meaning 8 out of 10%, 10 people tested. Those seeking medical attention at PMGH were turning out positive.
PMGH says in the last week alone, about 250 COVID tests have been conducted, 150 of which turned out positive. That's a positivity rate of 60% in 1 week alone. While sample results sent overseas may take some time to return to confirm whether this surge is predominantly the new Omicron variant, Dr. Sobi says they can only safely assume it is.
Those results may take maybe 2 to 3 weeks before we get the results back from overseas with regards to which variant it is. So in answer to the short answer to this, we don't know what it is. We can only assume, safely assume it's Omicron because of the high, we've gone from 10% to 80% in a matter of 5 days. Yeah, we can only assume.
As data shows an increase in reported cases at the hospital staff are also being affected, with 50 staff testing positive yesterday.
As of yesterday or this morning, we have about 50 of our staff, medical, nursing, and the corporate, the cleaners, have tested positive. So that's how quick. We have not experienced this in the first two surges where so many number of staff have become infected.
Currently, there are 23 inpatients admitted at the hospital's isolation ward, with a record of 5 admissions per day in the last 3 days.
At this point in time, none of the patients in COVID-19 isolation ward is on ventilator. Half of the patients are on single source of oxygen. The other half are in room air, but clinicians and medical personnel are attending to their other underlying medical